This podcast is not intended to be a substitute for professional advice, diagnosis, or treatment. It is in no way medical advice. For 24/7 free and confidential support, referral, and treatment options and guidance, please call the National Suicide and Crisis Prevention Hotline at 988. If this is an emergency and you are in an immediate danger to yourself or others, please push pause on this episode and immediately call 911. Hi, I'm Danielle Todd, and you're listening to None of Us Are Normal. All right, everyone, welcome back. My name's Danielle Todd, and today I'm here with Dr. Keila Roesner. We are going to talk all about natural health today. And Keila, why don't you just tell us a little bit about yourself to start off?
So, hey, I am so jazzed to be here with you, Danielle. Coming from different worlds, different perspectives, but as a naturopathic doctor, I've been in practice for over 10 years in Stratford, Ontario, Canada area. And the big thing I've really learned is that health affects all of us. And if we are not well, almost nothing else matters. Like we can kind of build our career, our life, our relationships, but ignore our health because we always kind of have it until we don't. And that is where many people come to me seeking help. So really my work is helping busy, stressed out women improve their energy, support their hormonal well-being, sort out stubborn digestive conditions, and get a good night's sleep so that they can carry on setting the whole damn world on fire.
Yes.
Yeah, because we can't do the things that we want to. We can't show up the way that we are meant to in our highest, fullest potential if we're exhausted, if we are crusty, if we are cranky, if we are sore and losing 2-3 weeks out of a month because we feel awful.
Yes, and you must run into a lot of people who have tried everything and don't know where else to turn.
I mean, there is definitely a certain amount of that. We're like, fine, I'll give this natural health thing a go. And then I also have many people that are like, you know what? I have a really deep mistrust because of previous medical trauma or because I've seen things happen with family members and I want to like opt out of all of that. So they come to see somebody like me. And really, I don't love the term natural health. Here's where we're going to blow up your interview. I don't love this idea that like all things natural are better, surprisingly, as a naturopathic doctor. Because when we start to get into the world of natural health, and you're going to see giant air quotes here, the term is really meaningless. Like it's very an artificial us versus them divide that many of us hear about. So it's like we have on one side, like we do things by the book. We trust the science. We follow the pharmaceuticals and we do the algorithms and we trust that it's all going to work out and we're going to find a cure and we're going to treat the things. And it's like a very masculine energy coming at things. Like, don't you dare question it. And then on the other side, we have what many of us think of natural health, like essential oils. And I'm gathering my herbs by moonlight and I'm going to drink this disgusting concoction, but it's full of vitality. And we spend money on the vitamins and grounding mats and breath work. And that's obviously going to fix everything. And it can seem so over the top woo. But that's not really what it is about.
I love that
at all.
So are you able to work alongside Western medicine then? Like, yeah. Okay. That's so cool. So what would you say to somebody who is maybe, I feel like, okay, so when I was like young, like probably in maybe even before high school, maybe when my sister was in high school, she got this book. I'm going to have to remember what it's called. I don't remember off the top of my head, but it was all about healthy eating. Mm-hmm. And honestly, when I was that age, like I was like, you're crazy. Like, give me my Kraft dinner and, like that's what I want. And she was like, no, I'm really going to try this. And it was basically just about having a balanced meal. Like it was like a protein and a carb and fat is what the whole book was about. And, getting enough veggies and all that stuff. And I was like, oh, you're like, I was like, how, and then my cousin, she only used all natural products. Like I remember going to her house and having a shower there after we went in the pool or something. And I was like, what is this shampoo? And she's like, oh, it's all natural. Everything comes from the land anyway. And I was so thinking like, no, thank you. I will take my chemicals because I feel like that's going to just work better.
Mhm.
And so that was, I don't know when it changed. Maybe it was when I started to read that book but I was just more open to the idea of a more natural way, or trying different ways before I went, I guess, with medication or whatever. And I would, you know, I'm the same way. Like if I need medication or whatever, I'll go to the doctor. But I do try to do more natural ways, quote unquote. I'm scared to, what do you call it? But what would you say to somebody who is kind of, you know, doesn't have any idea about the natural world? How do you step into that if you haven't ever been in that sort of area before?
I know it can seem like such a huge divide if you are doing everything like mainstream. And my grandmother always brought this brand of soap, so this is what I buy. And like we're very stuck in our ways. Naturopathic medicine, so it's a profession. So there is different ways that people can show up and practice this, but it is a postgraduate, like secondary degree. Um, and it's really based on the belief that our bodies are meant to be well, that our health is our birthright. And much like a medical doctor, much like a psychotherapist, much like a massage therapist, we all take an oath to do no harm. And that is really what underpins everything. We believe that we are meant to be well. So sometimes we just need to get out of our own damn way in doing that. So when I'm working with somebody, we look at the basics. We look at where you're at first of all, and what your goals are. So where are you at today? How much is that impacting your life? And where do you want to go? And then it is our job to get you from point A to point B, to be your quarterback in your corner, your wellness cheerleader, to move you from point A to point B. And when we do get into the realm of skeptics saying, this doesn't work and this doesn't work, and I don't know how these vitamins work, and my approach is never to counter that. I mean, my job is not to convince anybody. It is really to provide balanced information. And as a naturopathic doctor, my focus is really much more evidence-based than many others. So there are some that are very much like traditional, which there can be a lot of energetic medicines and a lot of like just intuition working. And it's a beautiful thing when it works. My perspective is a little bit more, here's what science is saying. Here's what the information that we have to date supports us doing. Here is what you are coming to me with and your preferences. Now let's make a practical plan for you, step by step by step. And for those that are countering, like, how can it work? I mean, I've often heard this idea that the best doctors are sunlight and sleep and good water and meaningful relationships and purpose in your life and nutrition and movement. And I really think it would be very hard to argue otherwise. Those things are important, regardless of where you're at in the world, regardless of who you decide to put on your healthcare team. And where I think a lot of people get tripped up is that they don't understand how things might help if you're presented a solution. Here, take some ginger because you have a headache, or take some magnesium instead of popping a Tylenol. And they don't really understand how or why it works because maybe they weren't explained. And that's truly, it's a copywriting issue more so than an actual issue, or they don't think there's science to support things. But I mean, just like any other profession, there are nuances to how we show up and how we practice. So that's where I mentioned that my practice is very much more evidence-based, and we work with like a really logical step-by-step framework to help people. And my practice is very much women's health focused. So women going through hormonal transitions like preconception planning, horrible menstrual periods, perimenopausal changes, postmenopausal health, and giving them a framework to essentially renovate their health so that their health is there for them, not something that we are just trying desperately to grasp at. So it's a very
Yes.
different perspective shift.
Okay, so your whole kind of thing is women's health. I know that you kind of do everything, you know, you work with everyone, but your main focus and what you really your passion is women's health. So what where do you start when it comes to women's health? Like what is your favorite one? You had mentioned off air that you are really working a lot with perimenopause.
Mhm.
And I know that there's a lot of things around women's health that is kind of underfunded and under, you know, educated, and like PMDD, endometriosis, all of those things.
Mhm.
Um, so what I guess broad overview of women's health. What do you cover?
I primarily work with people that are feeling hormonally stuck. So, in a perfect world, we are meant to get our menstrual periods. They are meant to be really low drama. In an unmedicated state, if you choose oral contraceptives for birth control purposes or whatever, that's a different conversation. But our periods are meant to be low drama. There are phases to our menstrual cycle where we may feel different energy or different mental capacity or different energy. Um, and I think it's important to be aware of how we feel at different phases. But ideally, your period should just kind of almost surprise you. Like it's regular, it's predictable. You're not losing copious amounts of blood, but it should almost surprise you. It's not, you're not sitting out for 2, 3, 10 days of a cycle because of your symptoms. And it should work that way, ideally. And if one chooses to start a family, ideally we conceive easily. We have a very healthy, low drama, low intervention pregnancy and birth. We are well supported in our postpartum recovery because that is important. And then as we hit our late 30s or mostly our 40s and we come into perimenopause, which is the 2 to 10 years before menopause. In pop media, we hear a lot about menopause, like, oh, it must be menopause, it must be my hormones. And what I don't think a lot of people realize is that menopause is one day. And I'm looking at your face.
Yes.
Menopause is one day. It is the anniversary of 1 year since you've had a period. That's
Okay.
all it is. Once you've hit that 1 year mark, you are now postmenopausal. So postmenopause for most of us is 20, 30, 40 years of our life. Like once it's been a year since you've had that last period, you are forever postmenopausal, which carries certain health risks, an increased risk of heart disease and bone health, changes in vaginal health, all of these things. You're just in a different territory postmenopause than premenopause, which is everything until that 1 year anniversary. So a lot of the work that I do in perimenopause is those 2 to 10 years before menopause, where we're seeing not only in a time of our life when we have a lot going on career-wise and with family and with responsibility and setting solid boundaries and becoming like fully formed humans, we're also going through a dramatic hormonal shift. And that is primarily where I'm working with a lot of women. And it's important because as we get to know ourselves and we kind of cross the line, we're like, this is not going to work for me. This is what's important. I'm recognizing I have less time left on earth and this is where I need to focus. Our brains are remodeling as we have less periods, as we ovulate less often. And there's also some massive mood shifts that happen. Many women go through depression during this phase, and it's very easy to say it's because you're busy, because your parents are ill, but we're also coping with a major hormonal transition. So to me, that's fascinating because these women come in, they're like, yeah, I can't afford to be sick anymore, and I matter. So I'm willing to do what I need to do to support my health. And that's the most exciting thing ever to me.
Yeah. I feel like, and I don't know, correct me if I'm wrong, but I feel like perimenopause is almost like a new word to the general public. I feel like I've even seen like Instagram stories about it where people say, you know, they're in their 70s and they say, you know, I wish somebody would have told me that this was going to happen, or I wish somebody would have given me a heads up, but people almost don't talk about it. It's like this quiet sort of thing. And then you hit it and they're like, oh, it's just menopause. Good luck, you know? And I don't know. I feel like it's this new sort of thing. I mean, it's not, it's been around forever, but I feel like finally giving it sort of a title makes you able to go in and say, hey, I'm going through something. What's happening here? Um, and kind of like I said before, it's sort of like undereducated, underfunded. People just don't know, and people don't talk about women's health as much as I feel like they should. So yeah, so thank you for being here and educating people and talking to people about this, because it's half the population that goes through it, you know? So
Mhm.
yeah, and it's not even just half the population. All of those people's partners have to deal with it too, right? So
1000%.
yeah, it's like a whole population thing. And so yeah, that's really a great sort of overview of everything there. So thank you. So let's get into, I read on your website about bioidentical hormone therapy. Uh you you practice this, you use this in your practice?
I
Okay.
certainly do. Yes. So bioidentical hormone therapy is a little bit of a misnomer. And technically, it's all considered hormone therapy, which hormone therapy is the addition of hormones therapeutically to treat a hormonal imbalance or condition or to support well-being. So different phases of our life, we have different goals for our health. And sometimes the addition of hormones can make the world of difference between like just barely coping and having brain function, preventing or supporting good bone density, reducing our risk of heart disease, or being able to enjoy sex without pain. So, kind of life altering. So,
Kind of.
yeah, just like a lot bit. So, bioidentical hormone therapy is using hormones that are molecularly identical to the hormones that our body would make. So, they're exactly the same shape as, say, our estrogens or our progesterones or DHEA and testosterone, which are other hormones that I don't work with as much because of my regulations on Ontario, compared to a hormone that is slightly different shaped. So the common one that we often think of is conjugated equine estrogen or Premarin, which is like a horse-based estrogen, which was the standard of care for women replacing estrogen for a very, very long time. So it's all hormone therapy. It's nuanced. And where a lot of people get tripped up and coming to see a naturopathic doctor or somebody that has wealth of experience in this area, it's not that bioidentical hormones are better because they're natural. It's not, shocker. It's that they're all synthetic. They all have to be made into a lab. It's that molecularly they are identical to what your body's making. So, yeah, and in one perspective, this is like if I give you a key and we want it to just open a couple of doors. Bioidenticals just gives you the key that's opening the couple of doors that we want versus hormone that is not bioidentical. It opens the doors, but it maybe opens a bunch of other doors that I don't want you to have access to, even though we have really good long-term safety data. So they're all therapeutic options, but that's something that I work with pretty frequently. And what many people don't know about hormone therapy, we've had a lot of bad press, particularly around 2002. There's a study called the Women's Health Initiative that basically looked at women taking hormonal therapy to support menopausal symptoms. And there was a lot of bad reactions, mainly in part because the women that were in the study were not really good candidates to begin with. So we are seeing like an increase in heart disease and an increase in liver failure and all of this and breast cancer. And then suddenly many physicians just stopped prescribing hormone therapy like 20 years ago. So now we've had a generation of physicians and a generation and a half of women going through one of the most important hormone transitions of their life, being scared of getting support and thinking that they just have to tough it out. And that, you know, it can't just be that this is a big transition. It's that I am uniquely crazy or I am uniquely weak and I can't get through it. And this is just how it is. But we've had, thankfully, a huge resurgence and good quality research dissecting the things that went wrong. And I use hormone therapy quite liberally. It's not the only treatment option, of course, but really what we're seeing, the North American Menopause Society, called NAMS, is like the authority here for how do we support women through these hormonal transitions. And according to NAMS, hormone therapy is the single most effective treatment for women to address hot flashes, which we call vasomotor symptoms, as well as vaginal changes, which there's a lot there that we can unpack, associated with this normal hormonal decline. And it can also help to prevent bone loss and fracture, which is all a really big deal for independence, given that we might live another 40 years through this hormonal transition.
Right.
So yeah,
So do
lots there,
you,
right?
yes. So I know that you kind of focused on perimenopause. Do you also use bioidentical hormone therapy for younger generations, maybe people who are going through puberty or PMDD or endometriosis or anything like that? Is that available for that, or is it mostly just for the perimenopausal symptoms?
We have a lot more research in perimenopause, and particularly like within 1 or 2 years of that menopause anniversary for sure, and later on in life. But that being said, even when we are in our premenopausal years, so basically any time from like your teens until you've had that last period, there are certainly times when that can be helpful. So, for example, if somebody is having trouble with multiple miscarriages, which is awful, but there's really good research to support taking prometrium, which is a form of progesterone, to help support that pregnancy and reduce recurrent miscarriages or pregnancy loss. So that's one really well established treatment. I've often used and seen estrogen at specific points in someone's cycle if they're having wicked menstrual migraines,
Okay.
which is associated with a big hormonal dip. Sometimes, if we're also having like really heavy periods, progesterone can also significantly reduce the flooding and the blood loss, which can lead us towards being iron deficient, which makes us very exhausted and can make us feel a lot more depressed and anxious, and like all things mental health, because of an iron deficiency, because of a hormonal situation. And we know that estrogen can be really helpful for brain health and mood and depression in some people. Special populations like polycystic ovarian syndrome and endometriosis, it kind of depends on the individual. There's so much more research emerging now, so we don't know all of the answers. So if someone's coming to me and they have one of these concerns, it kind of depends on where they're at in their life and what their goals are and how bad things are and how willing they are to play, if that makes sense.
Yeah. Yeah, it kind of reminds me of, honestly, the mental health world is, if you decide to go on medication for depression, say, you might have to try a few different types of medications before you find the right fit. And it sounds like it's very similar in your world as well. You might have to try a few different things before you find what works.
Totally. And I mean, big picture too, hormone therapy is one element of working with somebody. I mean, when someone comes to me and they say, I'm exhausted, I can't sleep very well, I get stress breakouts, and when I have to go to a gig, I have to run to the bathroom, and it's a lot of effort to get me out of there because I have IBS and I can't eat these foods. I mean, the first thing we're jumping to is not hormone therapy. It is, well, what's important to you first? And then also, how do you eat? How do you sleep? How do you handle your stress? What's important to you in your life? Tell me about your day. And we work through all of those things in a really structured, supportive way. And sometimes a medication is part of that. Sometimes that means I need to refer you back to your family doctor or a specialist, and I'm writing referral letters so that you are getting the care that you need. And I'm also working with my clients to give them the language to advocate and communicate with the rest of their healthcare team so that they're getting the care that they deserve. So many of us, we don't know how to have those tricky conversations. We were never modeled that. We were never taught, and we live in fear of pissing off our doctors. So we don't speak up if something's not working, even though it's, our quality of life that's really on the line. So
Yeah.
that's the more interesting part of the conversation too. As
Yeah.
vocally excited as I get about particular therapies. Yeah.
Yeah. And I love how you look at the body as a whole
Mm-hmm.
and everything all at once, not just somebody coming in saying like, I get really bad periods and you immediately think, okay, well that's hormonal. But you said the first thing that you talk about is like, how's your day? How do you handle stress? And that's so cool because I feel like that's something that might not always happen if you go to a really super busy family doctor. They might just say, oh, okay, well here, here's this, because that's what they were taught to do, right? So
Mm-hmm.
just kind of treating the symptoms as opposed to the problem as a whole. I that's what I'm really interested in when it comes to naturopathic health, is how you're like, okay, well, this could be because your stomach is upset and it's right next to your ovaries. I don't know,
Yeah.
like things like that, and so that's not a very good doctor explanation, but you know what I mean.
Yeah, that's entirely it. Is that we are never separate diseases and diagnosis. Like we are a whole functioning human being, and our organs speak to one another. And how your day is going, if you are constantly like pulling 12-hour days and not sleeping, and your only way to unwind is watching Netflix, your body's going to feel that. Your body has to do something with that information. And for some of us, that means we maybe develop a thyroid condition, or we experience depression, or we get food sensitivities because your body's like, things aren't working. You need to pay attention. And for some of us, that means our bodies slowed us down so that we literally can't push further. We have to like sit still and figure it the heck out. Our body is always trying to talk to us. And one of the perspectives in naturopathic medicine and in really body literacy is that symptoms are information. They're not always just things to quiet down. They're not things to manage, but it's our body telling us something. But most of us are so damn busy that we ignore it. We ignore the whispers until it becomes a slap upside the head that we can't ignore. So I love it when someone comes to me preventatively and they're like, you know what, I'm pretty good, but I want to be aware of what's coming. I want to understand what optimal is, not just, I don't have a problem.
Right. Yeah, and that's honestly that's going. I feel like that's kind of the same across the board. My sister is a psychologist, and she is all about going to therapy at all times, even if you're doing good, because then when a problem arises, you are able to sort of handle it better or be more aware before before the problem even happens. And so it sounds it's kind of the same in your world as well. Yeah, like preventative. I never actually thought of that preventative care in the naturopathic world. That's really cool. I know that there's a lot of different approaches to what you do,
Mm-hmm.
and you had mentioned some. I know that we talked about bioidentical hormone therapy. What about Chinese medicine? I remember going to you and you looking at my tongue. And I was like, what is going on here? And so, can you explain? And I know you do, or your practice does acupuncture.
Mm-hmm.
What is the kind of Chinese natural medicine that, yeah, I know that's like a broad question.
Let's explain thousands of years of medical history in a nutshell.
Yes,
So,
please.
Asian medicine in general is the broad overarching. Part of our training, in at least in Ontario for naturopathic medicine, is traditional Chinese medicine, which is a title protected term, much like psychotherapy, much like massage therapy. Like you have to specifically learn about this. And it's the understanding that everything is connected in the body, that there is a balance. And a lot of traditional Chinese medicine understanding evolved in a culture where ancestor worship was really important. compared to like in European medical history where like we would do autopsies on people and we would like understand the inner workings by looking at the body. In traditional Chinese medicine, we don't do that, or didn't traditionally do that. So they'd have to find other ways of understanding patterns in somebody. So looking at their eyes, looking at their tongue, feeling their pulses, looking at where they carry the weight in their body, how their energy is, and just getting a real feel of them very qualitatively. And then using herbs or certain exercise or food or acupuncture to correct that imbalance. So in traditional Chinese medicine, the tongue and the pulse are really important diagnostic tools, much like when you go to see your family doctor, they check your weight and your blood pressure and your waist hip measurement. Just another tool. And we can get a sense of how your digestion is looking at your tongue, whether or not you are sleeping well, whether or not there is some swelling. And there's some really cool correlations in mainstream medicine too. Like, for example, we can get a sense of maybe thyroid imbalances or B vitamin deficiencies by looking at your tongue as well. So it's just another tool of gathering information, and it's one that people are always fascinated by. Like, what do you see? What secret insight do you have into my body that I don't know about, even though I live there? And what I love is that seeing people engaged and interested in what their body has been trying to tell them. And the coolest part of that is teaching people to be body literate. And like
Yes.
the easiest example of this is like if you stayed up late and you're drinking and then you go to bed, like how does your tongue feel in the morning?
Dry.
Like, yeah, we're like all feeling it, like dry, thick, furry. Like there is a different feel in your body if you haven't slept and you're drinking more alcohol and like getting the nachos and the wings than if like you're up early in the morning getting sunlight and reading a book and drinking water. Like it's just going to feel like a different energy in your body. So it's another clue.
Yeah, that's really incredible. I was always interested in that, and I've been wanting to ask you for about 10 years.
Yeah.
Yeah, yeah. No, that's really, really awesome. I love that idea. And I feel like we went over to Asia and it was really cool. We went to Thailand,
Mm.
and in all of the stores they had herbal medicine,
Oh yeah.
like there was like ginseng everywhere
Mm-hmm.
and stuff like that. And I thought that was really, really cool because even in like their 7-Eleven, you could get, ginseng pills. And I thought that was really kind of neat. It's
Instead of
just
like Midol and Tylenol in your pregnancy test, it's like clearly you have some excess heat in your body, so you need to drink this chrysanthemum tea. Like it's totally different understanding. It's awesome.
yes. So I saw on your website that you are descended from a long line of Cherokee medicine women. And I would like to know more about what you mean by that.
So I come from, you maybe noticed this, but I come from a long line of storytellers in my family. So
Yes.
we have this family story that this English physician came over to North America, to the home of my ancestors, wanting to learn about the local plants and the medicines and healing. So the chief sent his daughter, a skilled healer, out with him to teach him. And part of that teaching ended up her becoming a mother to the newest member of the tribe. So
I
yeah,
love that.
our family telling gets a little bit more crass than that. So this has always been part of like the family legend that we are a line of healers. And my grandfather remembers his grandmother in a very rural like farming community um, near Georgian Bay area in Lake Huron, having people coming to the farm all the time with snake bites and farm accidents and just like garden variety headaches, stomach aches, childbirth, all the things. And like treating them with herbs, giving them something to smoke, giving them something to drink, like moving their body this way and another way to get them to feel better. And it was completely romanticized growing up that like we healed our body with the land and like that's just was like the neatest thing to hear growing up. And then of course you go to university and you're like, well, none of this stuff works. And science, science, science. And this doesn't make any sense. And then it wasn't until I was doing my training at the Naturopathic College that part of one of my rotations was going to Anishinaabe Health Services in downtown Toronto, like in a quite underserved area. And it's a facility dedicated to supporting Native people all over with their health. And we were able to offer naturopathic services. And it was so fascinating for me that someone could go and do their diabetes program, but also come to me for acupuncture. And they'd have these concerns, and we'd say, like, cool, I'm going to make up a tea for you because I also understand medically what this particular herb is going to do for you. But also we have this understanding of it works better if we add this other thing. We're not sure why, but it does. But we add this other vitamin to it, and we talk about your diet and make sure you're getting enough protein. And like together we're able to come up with a plan that's sustainable, affordable, and that you feel really involved in.
That's
So part of my own, yeah, it's like, it was so cool. It's like, it is art to me.
yes. Yeah, and I love your family history. I remember going to your your uncle's house, and I was just there one day, and I was feeling like I was getting a cold, and your aunt actually gave me oil of oregano, and I'm like, what is this?
It's
And
awful. It's awful.
yeah, it was terrible. It wasn't, and she didn't even give it to me in like, pill form. It was like drops in water and I had to eat it. But that's so cool that it's in, I didn't know that it was your whole family's way until you kind of told that story. That's
Well,
neat.
it wasn't. I mean, we grew up like everybody else, like going to the doctor, and the doctor's word is holy scripture. And it wasn't also until I started seeing my grandparents fail, like really not do well, one diagnosis after another, and pills that were getting mixed up, and all these things that I thought, there has to be a better way, because whatever that journey is, I want to opt out.
Yes.
And so many of us, we just benefit from knowing in advance the things that are well within our control versus saying, it's just genetic. That's just what happens to me. It's normal to only poop once a week and my doctor said it's fine. Like, no, none of that is normal. There's so much that is well within our hands that we can modify. There's things that aren't, but we can augment how much of a problem it is, or reduce the impact that some of those like genetic factors have in some cases. And to me, that's empowerment. That's exciting.
Ooh, I wanted to quickly touch on, what is seed cycling? I've heard a lot about that. Can you kind of give us an overview of it and what you think of it?
Are you seed cycling?
Uh,
You flirted with
Not
it.
particularly. Let me tell you, I have a nut butter that I get from Costco that has all four seeds in it that I take every
Awesome. I
single
know
day.
the one. It's delightful. It's
I
so
love
good.
it, but I don't cycle. So tell me more about it.
Okay, so you're not doing it all wrong, I promise. Seed
Okay.
cycling is the practice of eating specific seed combinations in accordance to your menstrual cycle, with the idea that we're trying to feed your body specific building blocks, the ones that are needed at that phase. And traditionally, it is flax and pumpkin in your follicular phase. So from when you bleed until ovulation. Some people do it in combination with the lunar cycle too, which is where people start to get really wooed out about it. And then the second combination being sunflower and sesame seeds, or chia or hemp, depending what you've got, from ovulation until just before your period, or the full moon to the new moon. And the idea is that, yeah, you're feeding your body. But we're not really seeing in research that this is particularly helpful. Like, we're not sure that for sure it's the pumpkin seeds that are doing it, and that your life is going to be significantly better if you have the sesame seeds, 10 days before your period versus like 3 days after. So what I think about this is like, cool, if this puts you in tune with the phases of your cycle, that's amazing. But you don't have to do it perfectly. And in fact, research is pretty clear that like a good quarter cup of seeds a day any combination, provided that they're like unsalted, not the gas station spits, like
Yes.
sunflower seeds, dill pickle flavor. But like
Is
any
that your
combination.
favorite?
No, absolutely. I never know whether to like chew the whole thing and swallow it or to like spit it out. It's confusing to me. It's like bubblegum ice cream.
Yes.
Um, but any combination of flax, sunflower, pumpkin, sesame, hemp hearts, chia, poppy seeds, all of that are really beneficial for giving you healthy fats and minerals and nutrients and protein. So generally I go with like keep it simple. Take a quarter cup of seeds a day. This is not me specifically giving medical advice, but take a quarter cup of seeds a day as part of your diet. And if it makes you feel better to do that as you track your menstrual cycle, cool. But your plan is not going to fail because you took one seed out of phase. That
Okay.
makes sense. Yeah, it's a very
Yeah.
traditional practice recommending seed cycling, and it's cool. I used to recommend it all the time, but I just see a lot of people get really frustrated by that recommendation and say like, "Oh, screw it, natural health doesn't work."
Okay.
Yeah, but
Do you
that's not
find
the
that
case.
a lot of people kind of give up because they feel overwhelmed with all of the changes, you know, because it's like we said, looking at the body as a whole, you probably have to make a few different changes as opposed to just popping a pill. So,
Totally.
yeah, do you find that people um don't have the patience for it?
It depends on where somebody is at. And one of the reasons that I love working with women in their like late 30s, 40s, 50s, the ones that have the career and the kids or the family, they have some boundaries in their life, is because they're like, well, I'm just going to do it. I'm just going to do what needs to happen for me to feel the way I need to feel to show up in my life. And earlier in my career, I would take anybody. I would work with anybody because, when you're new, like when you're a new musician, yeah, I'll play at the Legion. Yeah, I'll play at the seniors home. Yeah, I'll play anywhere because I just need exposure. And new in practice, it's like you have this unfailing enthusiasm that drinking lemon water is going to change everyone's life. And it might, but I'm a lot more choosy with who I work with. And the people that work with me are a lot choosier too because they understand the value of their time. They understand the value of if I'm going to invest my effort in here, I'm going to do it wholeheartedly instead of half-assedly. So yes, it's really easy to give up with anything, whether that is learning piano or starting a fitness habit or learning Japanese, if your motivation is not clear, if you're not hanging on to your why. So, for anyone that is starting a health journey, the first step is not like researching all the things to take for your diagnosis or your condition or because you can't sleep. It is understanding what is happening now. How does this impact my life? What do I want? And why does it matter? Because it's the why, the vision boarding of it, that is what's going to hold you to staying on track when things get hard. When you take your seeds out of cycle, or you like need to reorder your vitamins, or you have to go through another leg day and you're not into it. It's the why that you have to hold close.
I find that is kind of a common theme throughout this whole podcast. I talked with another guest who just completely changed her life. Her name is Sarah Tweet. And she went from, having high blood pressure and all these, medical problems when she hit 40 to completely doing a 180, and really focusing mainly on her physical health and her mindset behind it. And she said her why is, well, two different reasons, but one of them was chasing happiness. And she said, whenever I feel like I don't want to go to the gym, she said, sometimes I feel like I just don't want to go. And she's like, sometimes I listen to my body and I don't go. Other times I know like I'm just kind of feeling a little bit lazy. And I know that at the end of this workout, I'm going to feel happy. And that was her why, is chasing that happiness. And so I love that you said you have to focus on the why and focus kind of on the end goal and the journey to get there. I love that.
Yeah, we have to keep it really clear. And then the flip side of it too is sometimes we get so burned out Googling the things that we could potentially be doing for our condition, whether it's acne or sleep or weight loss or endometriosis. We're like reading the fine print of the Reddit forum and trying all the things and hoping some of it sticks, that we can get so frustrated because it's too damn complicated. And that's really part of the benefit of working with a practitioner that understands what your motivations are and what's most likely to get you the most benefit in your situation, so that if you're putting forth your effort, you're focusing on like 3, 4, 5 things instead of trying to do 12 not well.
Yeah. Yeah. And actually, we were talking about that right before we started. I
Mm-hmm.
told you that there was a time when I was going through hormonal acne and I had tried literally everything to make it go away. Like, I was like, oh, apple cider vinegar, give it to me, just everything that I could find online. And because I just didn't, I didn't have the education that obviously you have, that you went through, schooling and the last 10 years of being in practice. Has being in practice also taught you a lot?
Yes. I mean, it is, working with people is humbling and it is gratifying, and it is much like becoming a parent, one of the best educations going, because day after day you are faced with understanding where your strengths are, hopefully, and where your weaknesses are.
Yeah.
Because people are mirrors. They will bring up to you like where you are maybe not doing enough. And if I know, if I give somebody a really enthusiastic, optimistic plan about all the things they're going to do to support PMDD, and they need to do all these like exercise and take this supplement and look at this and all these things, and they don't do it, I know that part of that is on them and part of it is a copy issue. It's on me. Did I explain why all of these things were important, or which were the nice to haves but which was most important?
Yeah.
So there's that tremendous growth there, and I think anyone that's going through an entrepreneurial journey, we have that too. Like when we make changes in our own mindset, in our own health, in our own um, priorities, when we're clear on what our priorities are, we do better in our businesses. Versus if you're only investing yourself into your business and you're working the long nights and not eating well and not sleeping and all this, like everything else in your life suffers.
Yes. You can't give all of yourself. Even in your practice, you must give so much during the day, and so I know that you do a lot of things yourself. We were talking off air about how you have your own garden and you can your own food and you want to get chicken someday and all those things. And that really, I know that like that's not, I'm sure you're not going to prescribe to somebody, hey, you sound like you need some chickens, but I
I mean, it
I
can be good
imagine,
therapy.
yeah, yeah, you need to take care of yourself and replenish yourself, um, as to give so much to everyone that you give around you.
Yeah. And you know what? In the earlier part of my career, I would stay late and I would take on complicated patients. And I mean, I still do, but I would see somebody with this really rare condition. I'd be like, I want to be the one to figure it out with you. And I was like a Sheltie puppy in my enthusiasm. We're picturing it because I wanted to be the one to make the difference, and at the expense of my health. And I went through several periods of burnout that never diminishes my joy for what I do. But it wasn't really until I got support in a business mentorship at the same time as getting pregnant with my first daughter 3.5, 4 years ago, where I was like, you know what? I physically can't do all of the things because, a first trimester pregnancy can really knock the wind out of you sometimes. And I've since had a second little guy of 2 kids under 3. And there's nothing like having some finite time boundaries for you to be really efficient, for you to be really careful and selective with where you put your time. That includes the people that you converse with, the conversations that you have, where you put your energy. And yes, I still doom scroll on Instagram like everybody else does, but I'm also recognizing that if I'm doing that, it means that I'm taking time away from my fitness or from making a meal that I really like, or traveling. We do a lot of backcountry camping as a family, from exercise. So we become really aware of the preciousness of time. And at the same time, it's been really humbling to have worked with people for over a decade, being like, you have all these diagnoses, you're exhausted, you have a young family, and you're doing it anyways. Like, you are reaching out for help. And it's a brave thing for somebody to do when they're feeling rock bottom, exhausted, hit by a Mack truck, to like look somebody up, ask for recommendations, put the faith in that the fact that this person can maybe help guide them, because it's a huge risk being vulnerable with someone new, and then trusting in themselves enough to put in that effort to do the work. So it's
Yes.
humbling and it's gratifying, and we are all constantly learning from each other, but with like a lot more like force behind it when we're aware of what our value is and what our worth is.
Yes. And what the why is.
Yeah, exactly.
Yes. So jumping back to what you were saying, you have two children now.
Mm-hmm.
Did going through that period in your life, and you're still kind of going through it,
We're
having
in
young
it.
children, yes, and going through pregnancy and giving birth and you know postnatal care and all that stuff, did that change how you help your patients? Did it give you any, I mean, I'm sure it gave you a little bit of insight as to going through it. But did it change how you interact with your patients?
1,000%. One of the big things that I've noticed is that when people are looking for care, they're also looking for a connection. And as we are showing up to help people, we can't make it all about ourselves. If someone doesn't follow through on their treatment plan, it's not because they didn't like me, but it's that they needed some connection or that something wasn't clear. So when I'm working with someone, I want to make sure that we're a good fit for one another. And if I think your sister Leah mentioned one of her episodes, it's like, it's if you're working with somebody and it's not a good match, you try to understand why, but you can also move on. You can give yourself permission to move on as long as you're still moving in that direction of growth.
Yeah.
And there is that. I'm also, again, much more humbled about people's capacity to handle and take on things. So whereas I might have recommended many things to do for somebody before, we were recommending 3 things now to focus on, so that people have little wins along the way. Because when you're so dark and so deep in the hole of exhaustion, you need little wins. You don't need a bigger track record of things you couldn't do or things you failed at. You need things that you're winning at to get that dopamine boost to keep you going.
Yes. I love that. It's so wonderful, and I'm just really happy that you're here today to be able to, connect with the people who are listening, and maybe, if they're in Ontario, they would be able, are they able to work with you? Are they able to find you? I know that you can't work outside of Ontario. Is that correct?
That is true. So one of the best things post pandemic is that most naturopathic doctors like myself are working virtually, and that means we've opened the room for anybody within our same province or jurisdiction. So if you're in the States, you're probably working with somebody in your current state unless they are licensed in other places. As far as myself, yes, I love working with new patients. I love seeing people that are motivated to feel and claim their own life, their own health. And the best way to get in touch with me at this point is following on Instagram. We're at Dr._Keila. It's like Sheila with a K on Instagram, to see what we are up to. And in understanding that health is not always found in a one-to-one office visit. There's many ways through group programming and online coaching and your own self-awareness that we're in better shape to get the traction that we want with our health, even before you invest in seeing someone one-to-one.
Right. So we are, just so people know, we're going to put all of your information in our show notes in case they want to follow you or book an appointment with you. May I ask, is there a good thing to look for if you're looking to work with a naturopathic doctor when you're doing your research? I know that there's a lot of different types of levels of education.
Mhm.
Is there something that people maybe should sort of focus on when they're looking for their own doctor?
Depending on where you are at in the world, different credentials may be recognized or not recognized. So my degree is as a naturopathic doctor or doctor of naturopathic medicine, which means we've gone to one of 7 accredited schools in North America, and it's a postgraduate degree, as we've mentioned. And we've passed several like licensing exams, so we all have a certain level of competency. So you want to be looking for that. There are a number of like home study, like weekend courses that someone can do. And depending on where you're at in the world, naturopath may not mean that level of education that we mentioned. It might mean I learned some stuff and I'm passionate and maybe still able to help, but not necessarily that same thoroughness in all cases. Beyond that, once you find a naturopathic doctor, you want to get a feel for somebody and whether they have experience with your particular condition or set of goals. And you want to be able to communicate with them. You want to be able to be real with them. And in my office, people swear. I swear back at them because we have to be real. Like we have to like get each other on a level and have that level of trust. And I think that's what's most important, and then understanding what that role is. I mean, most of us hopefully have a family doctor and understanding that they provide a particular role, but we see a specialist, we see a psychotherapist, we see a massage therapist or a physio or a naturopathic doctor because we do different things. And I think it's really important to consciously build out your counsel, your health counsel that you gather information from, because we all have different perspectives, different things that we bring to the table to support you as a human that's trying to be well.
I was wondering if you actually deal with people who are just having mental health issues, such as personality disorders, depression, anxiety, panic disorders, anything like that. Is there some things that naturopathic doctors can do to help those people?
Absolutely. Uh, the basics apply no matter who you are and what your diagnosis is. Like, how is your sleep? How are you eating? Are you getting adequate nutrition? Are you exercising? And I know if you've been diagnosed with depression and someone's like, but are you exercising? You want to hit them upside the head because that's not the whole of the equation. But our bodies need certain things. We're like complicated plants. And just because like a plant needs water and sunlight and certain kind of soil and fresh air, you can't compensate for a lack of good quality soil by watering it more.
Right.
And people were like that too. You can't just like out exercise a shit diet.
Yes.
We still need to sleep, even if you are inspired. So regardless of the diagnosis, we still need to have some foundations in place. And that is where someone that is really mental health focused, I certainly work with people through mental health concerns because it comes up in every condition or every person that we ask, because we do ask. I'm always screening, like, how is your mood? How do you handle stress? And then for more complicated cases, I'm usually referring to somebody that loves working with that, because they're going to be far more up on, I mean, what is this particular vitamin therapy going to do for you? Are they aware of what adding this herb does alongside of your medication if you choose to take it? Does it actually make things better? So if I'm working with someone and they're not a great fit, I want to put them in touch with the person or their approach that will be, if it is not me.
I love that because I do feel like you were saying before, maybe in your new practice you would take on everybody, but you kind of specialize in the women's health, and that's who you focus on. And I think that's really great because it's going to help your patients and it's going to help everybody who comes to you if you're able to refer them to somebody who can actually help their problem. Not that
Right.
you can't, but who specializes in it and knows
And
more about it.
loves it.
Yes. Yeah.
But that being said, if someone is struggling with major depressive disorder, personality disorders, or they're like dealing with complicated grief, the basics that I would always be looking at is like blood work. Like you can go to therapy, you can exercise, you can all do the things, but if you have a iron deficiency, or your vitamin D is terrible, or you have a thyroid imbalance, all those things matter, but you still have to support your physiology. So that's often where I start with people too is, well, is there something that we don't know yet that we can
Right.
easily get some mileage on?
All right. So what can somebody do today to help balance their hormones if they think that they're having hormonal issues or anything like that? What would be some sort of go-to? I know that's a blanket overview
Yeah.
question, but what would you say?
I think the first thing is take an honest inventory of your life. That means be curious and pay attention. So, one of the most important things that we can do as cycling people is to track our menstrual cycle because we have major hormonal fluctuations. We're never balancing hormones. That's a huge misnomer. They're meant to fluctuate. But being aware of your patterns throughout the course of your menstrual cycle can give us a whole lot more information. Our hormones influence literally everything in our body, and we can never unhinge what's going on with our hormones to what's going on in the rest of our health. So we need this information to be able to be aware so that we can also clearly communicate with our healthcare providers if we think there's a problem. So when we're tracking our menstrual cycle, you can use an app, you can use pen and paper, but we know the obvious, like start tracking when you bleed, like how heavy is it, how long is it, is there any spotting? But you can also track things like how's my energy? How's my mood? Am I getting headaches? Is there breast tenderness? How's my libido? And you actually want to be tracking every single day. I recommend people do it like when they brush their teeth, they log into their app and most apps you can like click, click, click. This applies, this doesn't. So we're getting some data long term about your patterns because things will shift eventually. And it's often so subtle over time that we don't notice it. So now we have this record of not only your menstrual cycle, but your health over time.
I love that. I love that. That's such a great idea. And there are a bunch of apps to do that, that people can do. And I think that that's so good. It's like habit stacking to brush your
Totally.
teeth and do the app at the same time. This is such a wealth of knowledge and information, Keila. You're so interesting to listen to, and you have so much, yeah, just so much energy, and I love it. So thank you so much for being a part of today. If anybody wants to get in contact with Keila or has any questions, we will have all of your information in the show notes, so they don't even have to think at all. You can just check in the show notes and they'll be able to click on over and see you. But thank you so much for being a part of today.
It's my absolute pleasure, Danielle.
Now it's time for your pick-me-up of the day, a quick piece of advice to help you through hard times.
Hi, I'm Dr. Keila Roesner, naturopathic doctor for women's hormones. And my 2-minute pick-me-up whenever I'm feeling kind of funky is to change out the beverages that I'm drinking. So right now I'm working on some electrolytes and vitamin C for a little bit of energy. I'm a big fan of a fancy coffee at home with some frothy oat milk or a greens powder or a cup of herbal tea that I maybe grew in my garden. And I find that when you change your beverages at different times in the day, you get a little bit of a rhythm or a ritual in your day.
Thank you for listening to None of Us Are Normal. Being a human is hard, and I hope hearing from other humans on my show helps you in your own experience. For additional resources or to learn more about today's guest, please visit DanielleToddMusic.com.
So make it worth every joy, worth every pain. Look for the sun even when it rains. And hey, we're all trying and surviving. And hey, I'm just trying